Anaplastic carcinoma elderly women को होता है. The people who are more prone are in between age of 60 to 70. There is very much fixity to the underlying structures. There is carotid sheath infiltration, due to which common carotid artery pulse are not palpable, which is very sign positive. Majority of the patients have rapid swelling and in a short duration, and irregular, and consistency is very hard. There is infiltration of trachea, which results in stridor or scabbard trachea, and diagnosis is through FNAC. There is no treatment, as there is no, like, there is a low rate of resectability because of the local infiltration into the important structures. And sometimes the surgeon may do the resectomy of the isthmus in order to relieve the pressure on trachea, and post-operative radiotherapy is given. It is palliative. Sometimes, in some cases, within 6 to 8 months the patients die. Medullary carcinoma of thyroid, MCT, is a tumor which arises from parafollicular C cells, which are derived from ultimobrachial bodies and which are not derived from thyroid follicle. There are two types, like these tumor present in two different ways: sporadic and familial. Sporadic are 80 to 90%, and familial variety is associated with MEN syndrome, multiple endocrine neoplasia, and it does not arise from thyroglossal cyst. Men type 1 has pituitary adenoma, parathyroid adenoma, and pancreatic adenoma. Men type 2A is associated with parathyroid adenoma, pheochromocytoma, and medullary carcinoma of thyroid. Okay? So when this tumor is associated with mucocutaneous neuromas involving lip, tongue, and eyelid, it is known as Sippel syndrome, which with an occasional marfanoid habitus. It has got characteristic amyloid stroma. It is a solid, hard, and nodular tumor. It does not take up any radioactive iodine, and it do not depend on the hormones. The hormones which are produced by MCT are calcitonin, prostaglandin, serotonin, and ACTH. Spread is through lymphatic and blood. That is why the prognosis is very poor. Treatment is near total thyroidectomy or total thyroidectomy. Lymph nodes are treated by radical block dissection because they are fast growing when compared to papillary carcinoma. Genetic screening is to be done. All patients with medullary carcinoma of thyroid should get their RET point mutation on chromosome 10 screened, and if they are positive, the children of such patients should go prophylactic thyroidectomy prior to age 6. And if there are multiple secondaries in bone, oral radio iodine has no role because this tumor does not arise from thyroid cells. Only palliative radiotherapy can be given. And the calcitonin and medullary carcinoma of thyroid. Calcitonin is a marker of medullary carcinoma thyroid, and its level decreases after thyroidectomy. When there is a reoccurrence of medullary carcinoma of thyroid, there is an increase in calcitonin, and it is a marker of MCT. In normal person, calcitonin is not measurable, but when there is a MCT in a patient, you will see high level of calcitonin. Prophylactic thyroidectomy in relatives if calcitonin levels are very high. Thank you.